Jennifer. Welcome. We've started our TouchPoints Town Hall for May 22nd. It's 1 o'clock. Welcome.
Welcome. How are you today?
Very good. We're gonna wait a few minutes as our participants are rolling in. My name is Tim Bentley from the communications team here at TMC Health, and I'm gonna help you do your first town hall today. So we're gonna share the screen and
I appreciate it, Tim.
You're welcome. If you want to wait, 30 seconds, a minute.
Yeah, give everybody a chance to jump on.
And there's Mimi. She's going to be in the background in case we need her.
Hello, Mimi.
Oops, I'll turn off my video.
Okay. All right, Jennifer, I'm going to go ahead and share this screen.
Awesome. Thank you.
And I will drop off too.
Fantastic. Thank you, Tim. I really appreciate it. So good afternoon, everyone. I hope you're having a good start to your Wednesday, or hopefully you're halfway through it by this point. I'm Jennifer Mendrzycki. I am the president and CEO of TMC Health. I wanted to have this opportunity to speak directly to you, tell you a little bit about myself, and also tell you a little bit about what I've been up to as I get through halfway through my third week here at TMC Health. So we're going to talk a little bit about that. We're going to talk a little bit about why I decided to work in healthcare. Some of you may know that this is actually my second career. So I'll tell you a little bit about that and talk to you a little bit about my leadership and vision, some of my top priorities. Then we're going to talk a little bit about cybersecurity. I'm going to ask Alex Horvath to jump in on the engagement survey, and then we're going to share some great photos on both on Hospital Week that we just celebrated last week. So before I start, though, I just wanted to acknowledge that our colleagues at Tucson Medical Center suffered a tremendous loss at the beginning of this week with the loss of Dr. Sean Elliott. And so I just wanted to acknowledge that. I know many people are struggling with that. And although I never had the opportunity to meet Dr. Elliott, the things that I have heard about him make me very sad that I never got a chance to get to know him. He is, by all accounts, a wonderful individual who is deeply caring, not only about his patients, but about all of his colleagues and the community at large. So if we could just take 30 seconds, just as a moment of silence, to remember him and the legacy that he leaves behind. Thank you so much for that. I appreciate it. So let me tell you a little bit about me. I am in the middle of my third week here at TMC Health. And I want to start by saying thank you. Thank you to all of you. Thank you to the leadership team. Thank you to the executive team. I have commented to my family that I have never felt so welcomed to an organization or to a community as I have here in Tucson, and specifically with TMC Health. It's always a challenge, no matter what your role in an organization, to come into a new place. And there's always it's like that first day of school jitters, right? So you're always nervous. You hope you do a good job. You hope you do the right thing. And certainly that was true of me coming here to TMC Health. And then you layer on the fact that I moved across the country and that I am eagerly awaiting the arrival of the rest of my family. So I just wanted to take a moment at the start to thank all of you who have written to me, all of you that have stopped me in the hallways to welcome me and offer me some help and some guidance and support. It is truly, truly appreciated. And I thank each and every one of you for it. So a little bit about who I am and where I'm coming from. I grew up in New York, in the Bronx. Don't know if anybody is familiar with the Bronx, but it's an amazing community. It has its challenges, like every city does, but a lot of good people there, a lot of people trying to do what they can to improve their lives and the lives of their family. And so that's where I was raised. I moved from there to New Jersey with my family, and been living in New Jersey for 14 years. And now I am now a resident of Tucson. So I moved in 3 weeks ago to a great apartment downtown. I am living downtown in downtown Tucson. I will be doing that until my family joins me in August and we move into our new home. I am so excited to be in downtown Tucson. It is fantastic. I'm learning so much about the city. I having grown up in a city, I really love it. I think it's fantastic. I've had a lot of opportunity to walk around and learn some new things, and it's been tremendous to get that opportunity at the start of my time here in Tucson. Love the outdoors. My entire family does. We love going for walks. I do play golf. I won't say I play it well, so don't hold me to that. But my son is learning, my husband knows how to play golf, and my daughter's thinking about it. So opportunities for us as a family to get outside and spend time together, we really cherish those. So we're looking forward to doing more of that out here in Tucson. We also love going to concerts and music festivals, and my daughter is thrilled, and so is my niece, that we got tickets to see Hozier in September at the convention center. Super excited for that. So we look forward to doing that also as a family. I've been married to my husband for 25 years. I actually met him as a kid. Our parents were very close friends. And so we've known each other for a very, very long time. And he has been a tremendous support to me in my career and in my life. And he continues to do that, and was very excited to make this move out to Tucson. So he's looking forward to coming out here. We have two beautiful children that I gave birth to. I'm going to tell you about three others that in another minute, but the two that I actually gave birth to is our son, Teddy. He's 18. He is going to graduate on June 2nd from high school, and we will be taking him in early mid-August to Boston so he can start school at Boston College. It was his dream school, and so I'm so happy that he was able to make that dream a reality. And our daughter, Kate, will be joining us out here in Tucson. Kate is finishing up her sophomore year of high school. She is 16, so she will be moving out here, and she will be starting school at the Gregory School in August. And so she's excited, also nervous, which I think is completely normal. But really excited to come out here. She loves painting. She loves art. She loves everything about the arts. So I think that she will find a wonderful, wonderful home and place in Tucson. I have a couple of other members of my family. So in the photo you see above that little furry dog, you see my daughter and my son with my niece, Morgan. So I have a niece and two nephews. And one of the big driving factors of us coming out to Tucson is that we have a niece and a nephew who are out here already in Arizona. My niece, Morgan, graduated from the U of A. She's a very proud Wildcat. And she is now a teacher in Phoenix. And she is so excited to be able to come back and have a place to stay when she comes and visits Tucson and comes and visits us. And I'm hoping she's going to do this a lot. Our nephew, Devin, he's in the lower right-hand corner. He is 24. He is finishing his undergrad degree at ASU. He's got another semester left to go. And so we are excited to be able to spend time with them. And they are two of the other three that I consider part of my family and my children. I also have a nephew, Dempsey, who is 26, who's back on the East Coast. And I'm going to tell you a little bit more about why I consider them my kids in another minute. My final kid, as you see there, my furry kid, that's Winston. He's also moving to Tucson with us. He is 6 years old. My daughter, when we got him, she wanted to show him. We did that for a brief period of time. I don't think we were very successful at it, but he is very excited to move to Tucson too, because I hear that there's not a lot of squirrels, so he's not a fan. So he's also looking forward to coming out this way. So one of the things that I've been asking people as I've walked around and met with employees, I've asked them why they work at TMC. Why did they choose TMC? And I've heard a lot of different answers. And then I've also asked them, why did they get into healthcare? Why did they choose? Why were they called to healthcare? Because I do believe very strongly that you are called to healthcare. And so I've been asking people there why. And I've been hearing a lot about some of the other employees and their why. So I wanted to share with you my why. One more slide back. There you go, Tim. So that picture there is of my beautiful sister-in-law, Teresa. She is my why. She is the reason why I moved into healthcare. I was an attorney for 10 years and made the switch because of her and the impact that she had on my life. So Teresa was 34 when she was diagnosed with stage 4 colon cancer. At the time, she had my niece, Morgan, that you saw on the other slide. Morgan was very young. Morgan was 5. Dempsey was 3 and Devin was a year and a half old. So you saw Morgan and Devin on the other slide. And I spent a lot of time with Teresa in and out of hospitals and also at home and helping her to take care of those 3 children. And unfortunately, she lost her battle to colon cancer when she was 37. And so it was during that time that I saw not only the amazing care that the entire team provided to her, but the care and compassion they showed to me and our entire family during that time was really, it was moving and it was tremendous. And it was the doctors, the nurses, it was the respiratory therapists. She spent 5 weeks at the end of her life in the ICU. But it was also the environmental service workers. It was the security guards who snuck me in after hours so I could see her and spend time with her. So it spoke to me, and I made me realize that this is something I want to do. I want to hopefully have that impression and that experience and give that experience to someone else. I'm not clinical, and I'm not as smart as the clinical team, but I wanted in some way to be able to give back and be able to be part of that team that provides that compassion and that care. So that's my why. And I'll be talking to a lot of you about your whys as well. And you know what, if you're compelled, go ahead and throw it in the chat or in the Q&A. Love to hear about your why and why you were called to healthcare. So if you go to the next slide, I wanted to tell you a little bit about me as a leader, because I think that that's important too. Some of my leadership qualities, when you come into a role like a CEO role, you get to take a lot of tests. They never tell you about all the tests, but you get to take a lot of tests to learn about yourself and to learn about your leadership qualities. So what you see on the slide are actually the result of those tests. Here is what the test showed. I am a very big proponent of teamwork and cooperation and support. You're going to hear me say it a lot. Things happen, wonderful things happen when we communicate with each other, when we support each other, and we work together as a team. And so that is something that I am a very big proponent of, and it's something that I'm going to be encouraging everyone else to do too. I will tell you that as I go across the organization, I am seeing that over and over again. So kudos to all of you for the teamwork and support that you provide to your colleagues, and also the care that you provide to our patients as well. Try to lead from the front, make sure I'm not asking you to do something that I wouldn't do, or that I haven't done in the past. And I really believe in openness. I think if we can communicate with each other and be open with each other, we build the foundations for trust, and trust is incredibly important in every organization, but I think incredibly important in healthcare. So that's a little bit about my leadership qualities. If you go to the next slide, a little bit about my vision and my philosophy and some of my expectations. I've already seen evidence that the community is so appreciative of the care and the compassion that you provide to them. They believe that this is the highest quality organization in healthcare in Tucson and in greater Tucson. So I think that that's fantastic, and I want to build on that. I want to make sure that we have the highest quality care anywhere. I want to be the best place to work in Arizona. I want to make sure that we are not only retaining, which is incredibly important, our top talent, but being able to recruit more top talent in to support the organization, and that we're continuing to grow so that we continue to meet all of our community's needs. I endeavor for transparency in everything we do. So what you're seeing today, I want to make sure you know, is something that I have shared with the executive team. I have shared it with the leadership across the organization. I'm sharing it with the board as well. So and I'm going to be sharing it with the medical staff tonight. So I'm making sure that everyone gets to see exactly, so you'll all get the same thing. Everyone gets to see the same message. I think transparency is really important so that we make sure that we have each other's back and we're holding each other accountable, and you can't do that without transparency. I am here as a leader to provide support and accountability to all of you, and I expect that you will provide support and accountability to me too. And trust and respect is incredibly, incredibly important to me. I make sure to give it at every opportunity to everyone I come in contact with, and that's what I expect as well. my expectations, good lead into the expectations. So I keep it simple. Be kind, be accountable, and remember your why. I think kindness and accountability go hand in hand, and it's incredibly important in healthcare because we have to have each other's back, and we can't have each other's back if we're not holding each other accountable. And I want to do a shout out around accountability to the employee health team. To Erica and Camille, who reached out to me. I was supposed to get them a copy of my COVID vaccination sheet, and I forgot to send it to them. And they held me accountable, and they made sure to reach out and say, you were supposed to get this to us and you didn't. So I did get it to them, and I appreciate them holding me accountable for that. So thank you for that. And I hope that you will all continue to hold me accountable as well. And the remembering your why is incredibly important. I think it brings us back to, why are we in healthcare? Why did we get called to healthcare? And it reminds us of the joy that we usually find in healthcare, and it brings us back to that joy and that and our why. Next slide. Oh, and so I know we have something on that last slide. So if you want to put your why in the chat or in the Q&A, I'd love to hear it. I'm really looking forward to getting out and meeting all of you in rounds and hearing about your why. My top priorities as a leader, and I do believe it goes in this order. And I just had a meeting with our foundation board and said the exact same thing. My top priorities: quality, safety, and patient experience. It has to start there. It's why people come to us. They expect us to provide high quality. They expect us to keep them safe, and they expect us to do it in a way that recognizes them as a person and values them as a person. And that is incredibly important to me. Patients, those patients come first, and quality, safety, and patient experience drive everything else in the organization. So if you have high quality, high safety, and good patient experience, you're going to be able to retain top employees and top talent. You can recruit new ones into the organization, and you can gain those employees and their engagement. So that is incredibly important. The patients drive the people, and the people drive the payments. And so if it starts with quality and safety, if we're doing everything we need to do to remain safe and provide excellent quality care, then that will be able to drive our financial sustainability. So it goes in this order for a reason. Next slide. Thanks, Tim. So I'm going to be out and about. I've been out and about for 2.5 weeks. I'm trying to get out as much as I can. What am I doing as I walk through the organization? I'm trying to hear from you. I want to know what makes TMC Health great. And I've heard a lot of different comments. I've heard that it's the people. I've heard it's the people that everyone works with. I've heard that people love the community. They love our patients. I've heard a lot of pride in being an independent community hospital, community-based hospital. And I've heard that a lot. So I want to hear from you. Please enter comments in the Q&A about what makes TMC Health great. I really am interested to hear about it. I'd love to hear more about why you choose to work here. It is a choice, and we appreciate being the employer of choice for you. And why do you think patients choose us? I mean, many of us have been patients, either here or elsewhere. So what makes it a place that patients keep coming back to? I'd love to learn more of that. I look forward to learning more of that as I round through the organization and meet all of you. Next slide. So here's where I'm at. So I'm in May. Here we are in May, and we had my orientation to the organization was in Nurses Week, which I think is the absolute best time to join an organization. TMC Health does it like no place I've ever seen. The amount of events and accolades and just attention paid to the nursing team, and then again on Hospital Week was absolutely wonderful to see, and I'm so glad I got a chance to participate and go out and about. So that's what I did for the past 2 weeks. I've had my first town hall now. I can check this off my list. And I want to thank everybody for completing the employee survey, and I'm going to hold off on talking further about it until we get to that slide, and I'll ask Alex Horvath to join us. But that's been this month. June, I will be doing my rounds and participating in some department meetings and just getting to know all of you and why TMC Health is your employer of choice and why is it special. I'm really eager to hear that. And I want to hear about your why. And In July, we're going to start some Joe with Jennifer. I think it used to be Java with Judy, so we're going to keep the alliteration coming. Joe with Jennifer, some coffee chats, getting to know members of the team and learning about them and about the organization. I want to start a program that, and I'll bring this to you at a future date with a little more detail, but I've done this in past organizations and I've really enjoyed it. We call it a walk in my shoes. And really what it is me going and participating with employees and working elbow to elbow with them. There are things I can't do. I am not clinical, but I have done a lot of different things. I've cleaned floors. I've cleaned toilets. I've replaced a toilet. I broke a toilet once. Not my best effort, but I have participated in a lot of different departments, and it gave me a great opportunity to meet people, and it gave me a great opportunity to learn about why you're here, what you're passionate about, and also some of the challenges that you experience every day. So I'm excited to get that started. I'm looking to do that in July. And then we'll be able to roll out all of the employee survey results and hear about your feedback and let you know what we plan to do with that feedback, because we really appreciate you taking the time to provide us with that feedback. Next slide.
Hey, Jennifer, I wanted to, if you let me real quickly.
Yeah.
We have somebody who says TMC is great because of our people, our mission, and our values.
That's fantastic.
Yes, and so thank you for letting, they said thank you. And I would encourage if you have a question or a comment, you can put it in the Q&A section and I'll relay it to Jennifer and we can answer your question or relay your comment. So thank you for that comment. I wanted to let you know before we move on to Alex.
Thank you. I appreciate that. And I appreciate the feedback too. Thank you for sharing that. All right, so I think the next one, I'm going to turn it over to Alex. He's going to talk to us a little bit about our engagement survey.
Great, thank you. Jennifer, can you hear me?
I can.
Okay, perfect, excellent. So I wanted to begin by thanking, as Jennifer just did, everyone for their participation in the Engagement and Culture of Safety survey. Press Ganey is the organization we've used for our surveys for the last couple of years. They really are really focused on having the surveys being anonymous, giving people the unique opportunity to participate and provide feedback, and without worrying about anybody hunting them down or looking for them. And so the opportunity has been great. We do have our patient satisfaction survey, our HCAP survey, also conducted and administered by Press Ganey. So that gives us a unique opportunity as well to use and to correlate that data. That gives us a great chance to improve both patient satisfaction and employee satisfaction. So this year, as you can see on the slide, we've had 3,378 participants for a 74% response rate. That means that 74% of all of our employees, all of our colleagues across the organization have taken the survey and completed it, the whole thing, right? And that's compared to Press Ganey. I think they said they've had about 118 surveys taken across healthcare so far this year, and the average participation was 68%. So we're about 6% higher than the average out there, which is great. And that gives us an opportunity to have a very, very sound data for our survey. And there were two sections of the survey. I just want to remind you, one that we'll be looking at is the engagement, and that really means how engaged you are in the organization as an employee. And then the second is a culture of safety, and there was a series of questions there. And the culture of safety will be looking at in departments, but also our high reliability organization journey. That data will also support the direction that that takes going forward as well. So Press Ganey next will process and analyze the data, that the responses for both of these surveys. And leaders will be the first group to be able to see the data, understand the data, and then be able to share it with their teams. And that's really the most important part, is that rollout. Each leader will hold one or more meetings with their teams. And we have just a great amount of feedback to help us to improve. And there's a couple of bullet points there, but the most important one is really the intent is to identify those opportunities that exist for improvement and make those improvements. And there's no improvement that is too small. We've seen just a variety over the years, and there's nothing that is too large that we can't at least engage in it and begin dialogue and to take a look at it. So most important is what we do with this feedback. And as Jennifer said, we'll be rolling that out over the next couple of months across the entire organization. So we look forward to seeing you in the meetings, to discussing the survey results, to providing your comments, and then each department will have a plan. And at the end of that plan, to show the improvements, the changes in the departmental culture, the changes org-wide that you'd really like to see and that we'd like to see in the organization going forward. So we'll entertain any questions, of course, but thank you for the time.
Thanks, Alex. I appreciate it. And I appreciate everyone taking the time. I know it does take a little bit of time to complete the survey. I appreciate you doing that as a new leader to the organization. It's incredibly helpful for me to hear from you about what our opportunities are, what are we getting right, what do we have opportunities to improve on. So thank you so much for taking the time to do that. We really do appreciate it. And we will be doing something with the information that we receive. Next slide.
Jennifer, I wanted to,
Yes, sir.
Excuse my interruptions. We have Casey Callahan English from Northern Cochise says, I work at Northern Cochise. We love the family atmosphere that is present here. Our staff has total support from our administration. We see them daily and are able to interact with them whenever needed. Education and furthering of our careers very, very much supported here. NCCH has multiple staff members that drive significant distances to work with us. And they also state that they stay with us because of that closeness they have among staff. So
thank you for sharing
before
that.
we move on.
Oh, thank you so much for sharing that. And I actually got the chance before I started. I had asked to go out and meet with employees and rounded all the sites. And I got a chance to go to Northern Cochise and to Benson and to TMC Rincon. And I was very happy to meet with employees there. Mo Shelton did a great job taking me around and showing me the entire organization. And you do, I agree, you have a very special place there. And it certainly is a very family feeling in that or in NCCH. So I appreciate the time that everybody took to show me around, and I look forward to coming back out and visiting with you again soon. So thank you for sharing that. So cybersecurity, why do I have this slide up today? So wouldn't you know it, I was about 48 hours old in this role when someone attempted to impersonate me and send someone a text. And I just wanted to put this top of mind for everybody, because really what I wanted to do is to tell you, if you ever get a text that's supposedly from me or an email, and you're not quite sure if it really is me or not, please do not feel bad about not responding and sending that off to our cybersecurity team in IS. I will never feel insulted. I will never get upset with that. I would rather us all be very safe and secure with our data, because that's our patients' data, and it means a lot to them, and it also means a lot to us. So I will never be offended if you don't immediately respond to a text or an email that I send you because you have a concern about it. I highly, highly would recommend and encourage you, if you do get a text message or an email from someone and it doesn't look like it might be legitimate, please go out and send that to the IS team, to our cybersecurity team. And please remember, and I tell my mother this all the time, my mother's 85, and so she will frequently, and she's actually very facile with technology, but she will sometimes get phone calls or she'll get emails asking her for her personal information or financial information, because unfortunately that's scammers, that's where they go first, right? To our elderly who might be a little bit have a little bit of a harder time with technology. So I'm always reminding her not to do that. Don't provide your personal information, your financial information, unless you're the one who initiated the call. So please remember that. And if you ever have a question, I have found the IS team has been so responsive and so helpful. I actually had an email I received and I forwarded on to them. So if you do get one that you're concerned about, you're not quite sure, it's okay to go ahead and forward that over to the IS team, our cybersecurity team, and let's make sure we're keeping our information safe. And let's see. And last week was hospital week, and I was able to get out and about a little bit, and I saw so many people during hospital week. It was wonderful. What an amazing event. The number of events across all of the campuses was really, really impressive. And kudos to all the teams that put all of that together. And it takes a tremendous amount of work to do this, but it shows how much all of you are appreciated by TMC and TMC Health, and we are just so appreciative of every single one of you. You see great pictures there. We've got golden tickets. We had a fashion show. I think there was a cookie distribution. I posted a number of those on my LinkedIn page, photos from each of the hospitals. It was absolutely wonderful, and it was great to see everyone come out and celebrate and enjoy. It was tremendous, and I love getting pictures from all of the hospitals and all of the and TMC1 and all of the locations. So please keep them coming. Love to see it. Love to see the engagement. As you can see there, we went out and did some meal deliveries late at night, overnight, for the overnight staff at Tucson Medical Center. And what you see there is me trying my first Sonoran hot dog. And let me tell you, quite tasty. It's a new favorite. So I've told the family when they get out here, we all have to go try a Sonoran hot dog because it was really, really good. But thank you all of you for everything that you do every single day for our patients, for their families, for one another. It is truly, truly appreciated. And a big thank you to the teams that went and put so much effort in putting this together. I know how hard you worked for this. I know how long you worked for this. And thank you so much for doing that so that we could acknowledge the wonderful care and compassion that our employees have every single day for our patients. All right. It's question time. So feel free to throw some questions in there.
I know from experience that people are a little shy, so we'll
That's okay. I get it.
We do have Terry Tutt from TMC Communications. She says, I wanted to say thank you to you, Jennifer, for attending our Nurses in Hospital Week events to honor and appreciate our nurses and all of our employees. She's a special shout out to the councils and committee members that helped put it all together. So Terry wants to
agree.
Give a shout out to them.
Thank you, Terry, for the shout out to the teams. I really appreciate it. They did a tremendous job, and I hope everybody really enjoyed it.
So if people do have questions, we have our Q&A. It's at the bottom of your Zoom window. At the bottom, it says Q&A. You can type in a question. We can answer it live. Here somebody says, welcome to TMC, Jennifer. Question.
Yes.
Was it easy for you to adjust to the Southwest coast weather? So how are you adapting into the desert weather here?
Well, as you can tell, I tend to wear a lot of sunscreen anyway, but I certainly have upped my sunscreen game. I think I'm up to SPF 80 now. So, but honestly, it's absolutely beautiful. I know everyone is very concerned and has said to me, it gets very hot here. And I do know that from my niece and my nephew. So I am aware of it, but I have to be honest, shoveling snow really, really stinks. And so I'll take heat just about any day of the week. And on top of that, I don't know how many of you might have originally come from the East Coast, but the summer in the East Coast is incredibly humid, and it's oppressive. So so far this has been really delightful, and at night and early in the morning, it's absolutely beautiful. So I've been adjusting very, very well. I'm grateful for the number of beautiful sunny days, and I'm grateful for the chance to get outside. It's been really, really great. I know the hot days are coming.
Yeah, well, let's talk to you on June 17th and see.
Yeah. Yes, I know.
I know that you were also looking for suggestions, maybe from the staff, about some of their favorite things to do in Tucson and Southern Arizona.
Yes, please. All right. So yes, I need suggestions. So my daughter and her best friend are coming out on June 23rd, and they're going to spend a week here with me, getting acclimated. And my daughter, Kate, wanted to bring her best friend out so that she could show her all that Tucson has to offer. And so let me tell you where I've been so far. I've been to the Monica, which is phenomenal. Love it. I've been to Maynard's. I've been to Cup Cafe. I was out to El Charro Cafe actually on Monday night, which was absolutely wonderful. And a big thank you to Julia and Dr. Josh Lee, who accompanied me for that dinner. I appreciate your time. We also got to do the Meet Me at Maynard's walk, Julia and I, on Monday night. So that was really fantastic. Julia did a great job. She took me on a mural walk. I got to see some absolutely amazing murals, sent pictures to my daughter. Now she's all excited. She wants to do the mural walk too. So really, really looking forward to it. Trying to get to everything there is to get to downtown before I make my move to a house full time. So looking for suggestions. I've now had a Sonoran hot dog, which is great. So
Never have too many Sonoran hot dogs. Here, they're starting to roll in.
Okay, good.
Five Spear is great. The Desert Museum, Sabino Canyon, which I will also echo. You're going to live close to that.
I will, yes.
Gary Karchner in Benson says Karchner Caverns. He might have an inn for you there.
That sounds familiar, Gary.
Ben's Bell Studio, which is a Tucson treasure. And
yes, it's around the corner for me.
Yep.
I've seen that.
That's a great place. Cheryl in communications, one of my colleagues, always recommends this. Website, americasbestmexicanfood.com. Check it out.
Okay, I gotta write that
All right,
down.
I'll share it with you. Gary says he's not biased or anything. So lots of places, and you know, if you have a question or a suggestion, I know Jennifer pointed out early on there's easy ways through eConnections or just on an email that you could send her some suggestions. And
I would love that. I really would. I'm excited to get to learn more, and I'm also excited to show my family as well. So I'm looking for places I can take the kids and things that they might want to see too.
And so we have Gaslight Theater, which is also a fun Tucson treasure, been around for 45, 50 years.
Oh, nice. I should have mentioned. I'm sorry.
That?
I should have mentioned. So I mentioned the Hosier concert, but I actually have tickets for the Rialto too. So Sebastian Bach, I'm probably dating myself. I don't know who's familiar with him, but he was the lead singer of Skid Row. So I told my daughter about him. She hasn't heard a lot of his music, but she does remember him. He played a character in the show Gilmore Girls, and she and I have watched every episode of Gilmore Girls. And so she's super excited when she comes out with her friend. We're going to go see Sebastian Bach.
Charles,
so I'm excited. I'll get to see the Rialto, which will be great.
Awesome. And that's a cool spot too. Charles at Northern Cochise says he's new as well. And I hope that you're welcome to the organization like he was.
Oh, fantastic. Welcome, Charles. Nice to have somebody else new like me.
If you head down to Wilcox, which you will on your tours and visits, the Chiricahua National Monument is recommended.
Okay.
And that is beautiful.
Okay.
Kit Peak, which is just west of town, is a world-renowned observatory. I think they have close to 20 telescopes. Kit Peak.
Oh, nice.
Outdoor concerts, which you already love, at Monterey Court. Summer Haven on top of Mount Lemon.
Oh, really? I didn't know that. That's great. Kate will love that.
Yeah. Here we have a question.
Sure.
And somebody also suggested if you're down by Wilcox, you could go to the wineries for wine tasting. So you could have quite a day down in Wilcox.
That's fantastic.
So the question here from Joshua Lee. Now that you have a few weeks of exposure to TMC Health broadly, do you feel there are any areas of focus that should rise to the top of our current priority list?
It's a great question, Josh. I think I'll harken back to my top priorities. I know that with the recent Leapfrogs survey we received a C, and I'll tell you, I have been in my prior organization. We had received a C, and unfortunately, we even went down to a D, and it was very disheartening for all of us because we did not believe that we gave D quality care. And so it was a moment for us to really reflect and look inward and say, what could we be doing differently? How do we make sure that we are doing everything we can to provide high quality care and safe care to our patients? And I certainly see across the organization that level of effort. And I certainly know from talking to people in the community that they believe that all of you give excellent care and you have amazing compassion for the community and our patients. I think that one of the things that's rising to the top for me is that continued intense focus on quality and safety and patient experience. But that for me is definitely rising to the top. In the organization I was in, when I came into the chief operating officer role for the system, we were at 2 Ds for our 2 big hospitals. And May 1st was my last day in that organization. And I am happy to say that we with a lot of intense effort and a lot of collaboration between physicians, nurses, other members of the clinical team, the administrative team, non-clinical members of the team, we were able to come out on May 1st with an A and a B. So I know it's possible. I've seen it happen. I've participated in it. And I know that is an A and a B are more reflective of the care that we provide. And I know we can get back to that. So I'm committed to helping to support that and to being a part of that team. So I would say that's certainly something that is definitely top of mind for me. And I know it is for many others on the leadership team.
Great, thank you. We have a few more minutes for questions. We have one that just came up asking about what could we do to help improve community outreach in rural areas. We have a big, Southern Arizona is a big area.
Yes.
What are your thoughts on improving community outreach in those areas, in rural areas?
I have to tell you, I've not led a rural organization or an organization that had rural components to it before. I have led small community hospitals. And I think when I was leading a small community hospital, it really came down to the relationships that we make in the community with community leaders and trying to engage people to participate. We had to do it in many different ways because everybody wants to participate and can participate differently. So I would love to hear more from Benson and NCCH on what you've been doing to be able to connect to the community, and how might we be able to support you in those efforts, and what do you think the system needs to do to support you in those efforts. We are a system, and we are here to support you. And I think that's something that's top of mind for me. Having led a small community hospital, I know sometimes the focus turns to the larger hospital, and I understand that, and they are very important to the organization, but the smaller hospitals are too. And how do we make sure that the teams there feel connected to the system, and how do we make sure that we're supporting the community the way that the community wants to be supported? So I guess one of the things I would say is reaching out to the community and asking them, what is it they need, and how do they want to be supported, and how do they want to be connected with?
And how about this last one?
Sure.
Big component here is we do an excellent and amazing job of caring for our community, but I also think we put a lot of effort into caring for our employees and for each other. And this person asks, as a leader, how would you handle stress? And maybe how would you handle stress, or how would you recommend that employees handle stress in their lives, around the workplace here?
It's an excellent question. I think it's something that we all struggle with. I will be perfectly honest with you. I certainly would never stand up here and say to all of you that I am the example of how you deal with stress. I certainly think I have a ways to go to learn how to deal with my stress. And I think that everybody does. I participated in the leader team meeting this morning at Tucson Medical Center, and we had Mary get up and walk us through a wellness exercise. And I said to Mimi, I thought that was absolutely fantastic. And I know that she does that for her meetings monthly, and I'd love to have more of that. And you know what? I'd love to have it here at this town hall too, now that I'm thinking about it, because I think it would be great for all of us to get the opportunity to learn more about how we deal with stress. I'm trying very hard myself to do more physical activity instead of eating. I am a stress eater. That is how I cope with stress. It's not great. It's not a great way to cope. I think one of the things I'm trying to do as a leader is reach out and talk to people and give them space and grace, right? Because everybody's going through something, and a lot of times it's something that we don't know about. And so I try to give people I try to check in on people, my friends, my family, and my colleagues, make sure that they're okay, and also give them some grace that maybe they're not having the best day. And how do we give them a little space and a little grace to help them get through their day. I wish I had a better answer than that. I don't know that I do, but I'm certainly committed to working towards it, because I think it's incredibly important. The past 4 years have been incredibly stressful, and I don't know that I'm pretty confident. I shouldn't say I don't know. I'm pretty confident that we haven't dealt yet with all of the stress that came from the past 4 years. I know I certainly haven't. So I think we have a ways to go, and I'd love to talk more with all of you about what you do to combat stress and what you think we can do to help support you in that.
Well, thank you very much. This is also a reminder to you, Jennifer, and to the people listening. We'll resurface the employee wellness tools that are available to our employees online and through eConnections and through your other portals. We'll resurface those. That's a good reminder for us, Jennifer, to resurface those.
And I would actually also say, Tim, not only to use the tools, but to reach out and ask for help if you're stressed. If you're experiencing stress, if you feel like you need a shoulder, if you need somebody to talk to, I'm happy to have anybody call me, but I also recognize I'm brand new and you might be afraid to do that. But I certainly think we all need to be able to reach out and ask for help when it's needed. And certainly I have taken advantage of help too. This is a transition for me. It's a big transition. My family's back on the East Coast, and that can be lonely and it can be hard. And I accept that. And I know that this is something I have to, work through and get to that point where they come out. But I've been leaning on my friends and on my family to be able to help me get through that period of time. And I've reached out when I've needed help. And I hope that people will do that as well.
Great. Thank you very much. Anything else before we go? Before we call this your first town hall? We got you through it. Anything else you'd like to share?
The only other thing I'll ask is if you've got suggestions, things that you think we should be doing in this town hall, things you'd like to hear about, any of that, I'd love to hear it. This is my first one here. I always think there's room for improvement and room for doing things differently. And I'd love to hear more about what's important to you and how this forum can be helpful to you. That's the whole purpose. So please you can drop me an email. You can send them to Tim. Any way you want to do it. Happy to take suggestions, and I'd love to hear what is it that you want out of this town hall, because it's really for you, and I'd love to hear what you'd like.
Well, Jennifer, nice to meet you. Welcome to TMC. We'll see you again soon. Thank you very much for all.
Thanks, Tim. Thank you all. Have a wonderful rest of the Wednesday. Take care.